Hi everybody, after a short break of almost 2 weeks, I start with this video, my weekly video presentations. In this video, I will discuss the ECG findings in the ECG exercise number 15. I hope you will enjoy it and join me in my future video presentations. Thank you. The patient is a 62-year-old man who was originally referred to our center for PVC ablation. Echocardiography showed LV dysfunction with an ejection fraction around 45%. Coronary angiography was normal. Cardiac MRI showed an ejection fraction around 44%. In addition, as we see here, the MRI showed a large late gadolinium enhancement area at inferior wall compatible with a diagnosis of inferior wall myocardial infarction. This is the original ECG of the patient, which was interpreted as ventricular bigeminy. But if we look closer at the ECG, each QRS complex fulfilled the criteria for a ventricular rhythm. In addition, after each QRS, we can see a retrograde P wave, and therefore this ECG actually shows a ventricular tachycardia. But what is the mechanism of oscillating morphology? In addition to different morphologies, actually in this case just two morphology, we have also oscillating cycle length, short and longer intervals between each QRS complex, and therefore this is an interesting example of a ventricular tachycardia with oscillating exits and most probably also oscillating circuits. So this is the next ECG of the patient. On the left side, we see the same phenomenon. We have the ventricular tachycardia, and suddenly the tachycardia changes, and then we'll see on the right side the group beating. But when we follow the intervals between QRS complex, we can see that actually even on the right side, we deal with the same tachycardia, but with the exit block in the VT circuit. And this is an interesting example of ventricular tachycardia, sustained ventricular tachycardia, most probably with exit block in the VT circuit. In another ECG of the patient, we observe the same phenomenon. It looks like group beating, but when we follow the cycle lengths and the interval between the QRS complexes, then we can realize that still we have a sustained ventricular tachycardia with exit block at VT circuit. This is the last ECG of this patient during tachycardia that we see together, which again shows group beating, and most probably, as we explained in previous ECGs, we have a sustained ventricular tachycardia with exit block at ventricular circuit, and most probably in this case the exit block was at the more septal exit, and we only see the second morphology, which is more inferior compared to the first morphology. So in conclusion, the first ECG actually showed a sustained ventricular tachycardia with oscillating exits. The subsequent ECGs showed an interesting phenomenon of exit block at the level of VT circuit. The patient underwent catheter ablation, and here we see the ECG in sinus rhythm after successful ablation. I hope you enjoyed this short video presentation, and I would like to invite you joining me here in my future video presentations.